Welcome to the Greater Winter Haven Chamber of Commerce Ask the Doctor series. This series is being done in partnership with Baycare's Winter Haven Hospital to help you, the community, learn more about our local physicians, as well as the important programs and services Winter Haven Hospital provides to keep our community healthy and thriving. So how do you draw a line from experience being a helicopter mechanic to being an orthopedic surgeon? On this episode, you'll find out. I have the absolute pleasure of interviewing Dr. Landfair, an orthopedic surgeon located right here in Winter Haven, who specializes in hip and knee replacement, arthritis, and treating musculoskeletal disorders. So Dr. Landfair, thank you so much for joining us for this Ask the Doctor series interview. And I always like to start these with learning a little bit more about you personally. So tell me a little bit about, where did you grow up and where did that spark for potentially going into medicine come from?
All right. Well, first I'll say thank you for having me. I'm very grateful for how welcoming everybody has been around here. And thank you for giving me this opportunity to kind of, introduce myself to the community. I hail originally from Saginaw, Michigan, which most people don't know where that is, but there is a Saginaw, Michigan. It's kind of like a small city, and it has like a lot of ties to the auto industry and the failure of the auto industry and all of the socioeconomic stuff that happened subsequent to that. But it's home, and a lot of people I love are still there. After I graduated from high school, I went to the Marine Corps for 5 years. I served as a helicopter airframes mechanic and quality assurance representative. So I inspected helicopters before they went out for flights and missions and stuff like that. I was a sergeant before I was honorably discharged. And then from there, my story is kind of convoluted, but then from there, I went to community college for 2 years, transferred over to the University of Michigan for undergrad, where I obtained a bachelor's degree in movement science. At the same time, while I was working as a personal trainer. And then after that, that's where it kind of bridges off into what you were asking about. How did I become interested in medicine? So while I was a personal trainer, I was, I loved it, and I loved, learning about exercise physiology, biology, all of those things. And at the same time, I had, a lot of clients who had medical issues that I was like, okay, we got to work around them. Even, let's say, for instance, somebody had diabetes, so I had to kind of construct a diet plan that was, considerate of those issues. Or somebody had arthritis of the knee, and I had to work around that in terms of our exercise plans, things like that. And I actually became more interested in that than, forming the exercise plans or working people out. And I was like, well, okay, this is interesting. Like, what kind of person, deals with this? And of course, it's a doctor. And then I started looking into, the qualities of what a doctor should be. And I was kind of on this website, it's like checklist thing. And I was like, oh man, that's kind of sounds like we want to help people, want lifelong learning. Yeah, like all of those things sound pretty good. Well, they didn't tell me that it was going to be like a million years later before I was actually a doctor, but that's another story. So yeah, that's kind of how I got interested in medicine to start.
I absolutely love that story. And I feel like I'm going to send this to all of our principals in Winter Haven and say, show this to the kids, because I think a lot of times people think you have to pick a life path and that's the life path that you're going to be on. And if you didn't pick that life path from the very beginning, then you can't change, right? You're on that trajectory, and that's the trajectory you're going to be on. But in my career and my interaction with physicians in this community in particular as well, military service is so huge to developing that kind of well-rounded outlook on the community and on service and on things of that nature. But even being able to start as a personal trainer, and I mean, just you've seen so much in your career. So if you don't mind me asking, how old were you when you finally made the leap to go into medical school?
So when I started medical school, I was 27.
Wow.
So most of my colleagues were around 22, even though the average age of the medical student in the United States is kind of increasing because a lot of people are, having alternate pathways to medicine like myself,
Mhm.
or, it's a second career, or, they take some time off or something like that. But most of the people that I was in class with were 5 years or, younger than I
Mhm.
was. So, but no, I agree with you wholeheartedly about that. And I tell people, don't, whatever you do, just do it to the best of your ability, because it might just be a stepping stone to something else, and you don't know it yet. But if you do well at what you're doing now, people will notice that, and then as opportunities opens up in different other pathways, it'll lead you to something else that you never even thought. Like I love what I do, and I never even had an inkling of an idea that I would be doing what I'm doing today. So yeah,
Absolutely.
yeah.
Yeah, I'm sending this to the schools. They need to hear this. Be excellent at what opportunities you have right now, because they will
Yeah,
lead to the other opportunities down the road. Oh my gosh.
yeah.
You need to be a motivational speaker too, as
Oh
well as
God.
a physician. So you decide to go to medical school. How did you
Mm.
decide what path of medicine to go down?
So that was another convoluted story. I originally thought I was gonna cure obesity. I wanted to go into medicine, pediatrics, and I was doing research in undergrad, centered around obesity and its detrimental effects. And then when I got to medical school, my third year, I had a surgery rotation, and I was like, oh man, this is going to be horrible. And I remember the first day I was on the most notoriously like difficult and strenuous rotation, which was cardio thoracic, specifically the thoracic surgery service. So I remember I was in a case for like 12 to 14 hours. I can't remember exactly, but we were in the OR all day. And of course, I messed up and put my hands down, and like I got yelled at because this guy was, old school surgeon. But I remember I walked out at like 9 or 10 o'clock that night, and I was like, that was the coolest thing I've ever seen. So that started me on the pathway to surgery. And then by the end of the week, even though I got like 4 hours of sleep a night, I was like, yeah, I gotta, this is where it's at. So I thought I was gonna do cardiothoracic surgery, but then I had a rotation in orthopedics that was amazing. First of all, they were more kind of my kind of people. Like we just vibed
Mhm.
better. And then I was involved in a total knee replacement. And it was like I was just taken back. Like I was like, I can't even believe this is something that other humans do to other humans. Like, and because it was like, we were using drills and saws and everything that I was used to as an airframes mechanic, on helicopters. So it was very like close to home for me. And I was like, I can't believe like we're using the same instruments that I would use on an aircraft to help people have like reclaim, function in their lives. And then seeing the patients afterwards, and I was like, oh my God, they did that. And then this patient is able to go back to playing with their grandkids, or, play golf or enjoy their retirement. Like these people work hard, like they need to, this is not the time for them to be laying in bed, decrepit. If they can get some function and quality of life, like, and just seeing that, I was like, all right, this is where it's at for me. So orthopedics was, yeah. After I saw all of that, I was done.
Have you ever gone back to your military buddies and said, hey, did you know all that equipment that we use? I'm
I
actually
actually have
using all
not.
that same stuff.
I have not had that conversation yet.
That really should be a recruitment tool for airplane mechanics.
Right? I know it could be.
You too can be an orthopedic surgeon with the skill
Exactly.
set.
Yep. It's so
So,
true.
so did you you graduated from medical school then
Mm.
with a focus on orthopedics as you graduated?
So when so there's the match process that happens during the last year of medical school, and I was fortunate enough to match into my residency program, which is in Philadelphia, Einstein Medical Center, um, which was, of course, orthopedics residency. Yep. Yeah.
And so how did you end up in Winter Haven? What was that career trajectory like? Obviously, with the match program, for the audience that doesn't know, it's kind of like a lottery a little bit in terms of, you're putting yourself in, you're applying for different things. And then this one day of the year, all of the physicians around the country are waiting to find out where they've matched and where they're going to end up spending the next segment of their career, learning from. But then you get to a point where you actually start to get to choose where you want to be. And so what was that process like for you?
Yeah, so I did that. I did a residency in Philadelphia, and I also did my fellowship in joint replacement in the University of Pennsylvania in Philadelphia as well. So throughout this whole time, I also knew that one thing. So I told you my story is very long and convoluted, but I also have 2 children from a previous relationship. They actually have been down in Lakeland since I started residency. So my goal all along throughout my training, my graduate training, was to get back to them, because it was hard. It was really hard. It was really, really hard to be away from them for all of that time. It definitely affected me, and I'm sure it has affected them as well in some way. So one of my primary goals, and what brought me to Polk County mainly, was to reconnect with my kids, and be there and be physically there for them as much as possible. I just happened to get lucky enough that there's an opportunity here in Winter Haven, where there is a need. And I'm sure you'll ask me those kind of questions later, but I mean, I can't say too much bad about this place. Like, I've definitely met a lot of great people here. So I'm fortunate that those 2 things kind of lined up, like me searching for a job to reconnect with my daughters, and also having an opportunity to do it at a place like this. So
yeah. Well, we have to publicly thank your daughters for bringing you to our community, because you are right. There is a need. So there's a general need for access to healthcare in general, certainly, but there is a need for access to specialists as well in the area. And so, talk a little bit about, what are the needs that you've identified in the Polk County community for a specialist like yourself? And what are some of the things that you specialize in your practice? Why would someone come to see you?
Okay. So as a general and specialist orthopedic surgeon, a lot of the needs that I see are based on musculoskeletal, like injuries, or degenerative stuff like arthritis, just general wear and tear of the body, the musculoskeletal system. So, I mean, I see people who come in with back problems, shoulder problems, wrist problems, fractures, anything related to bones, joints, ligaments, tendons, everything from head to toe, we see in our practice. My subspecialty focus, and the thing that I'm most passionate about, is like what brought me to orthopedics in the first place, which was joint replacement. And it's that ability to help restore people's function and give them a better quality of life that I still like. I saw a patient in clinic, Monday, she was 2 weeks from surgery, and I was like, you go, girl, you did that. Because she's working hard too. She's doing her physical therapy. I tell my patients all the time, like, look, this is a team effort. Like, I have to do my part correctly. I have to put in the implant, make sure it's aligned right, and the ligaments are balanced, and all this other stuff that you don't need to worry about. You worry about what's going to happen after surgery, because you're going to have to do the physical therapy and all of that. If I do my job right and you do your job right, we're going to do the best for you, and hopefully you can, get a much higher quality of life. So it was just good to see, her come back in and just be happy, walking around, like twirling her cane. Like, yeah, everybody's like, when did you get your knee done? She's like, 2 weeks. She's like, what? You look good. I was like impressed too. She looked great. So it's just, having that come in. Ooh, I got off on a tangent. I'm sorry.
As you're telling me that story, I'm thinking back to your career as a personal trainer. I mean, I'm sure when you were in that field,
Yep.
you had numerous people that were on the backside of something very similar to that. So they
Yeah.
finished their medically prescribed physical therapy,
Mhm.
but then they're trying to rebuild strength. They're trying to get their mobility back and all
Yep.
of the things that go along with that, that goes beyond the, what you prescribe to your patients for physical therapy
Right.
afterwards. So I just had to smile because it literally is everything that you've done in your life has layered
I
upon.
know. Isn't it crazy?
It is really crazy, the puzzle of your life and how it's all fit together. So talk a little bit about your practice. So where is your office located?
Our office is actually right around the corner from the hospital. It's Avenue I think.
Mm-hmm, mm-hmm.
It's right on the corner, um, right at the end of the parking lot of the emergency department. So it's almost like it's attached to the hospital. It actually used to be, part of
Mm-hmm.
the hospital, I think, or something like. I don't remember exactly what the circumstances were, but it's really close to the hospital. What was the other question? I'm sorry.
And do patients, can they make appointments with you directly, or are they typically referred to you from a primary care physician or another physician?
So that's kind of insurance dependent. So they can call our office at 813-684-2663 to try to make an appointment directly. But sometimes the insurances require you to get a referral. And if that's the case, then you can, call your primary care physician and ask for a referral, ask for myself, tell them what body part it is that's affected that you need help with. And that's pretty much usually the process. It's either one of those two pathways. Yeah.
And so one of the things you talked about a lot of those common symptoms or even diagnosed illnesses that you end up helping your patients either treat or overcome.
Mm-hmm.
Is surgery always the answer for your patients, or are there other methods that you as a physician kind of knock out first before surgery?
Oh yeah. If you talk to any of the patients that I have performed surgery on in an elective sense, like meaning somebody didn't break something and had to, they need surgery. If somebody had to make a choice, like either I suffer with this or I try surgery, they will always tell you that my strategy is to exhaust all conservative measures first, because I want to make sure that we try everything before we go to surgery, because it's a big thing. It's a big thing. We're trying to recreate something that we didn't make, right? So that's not a simple undertaking and something to be taken trivially. Therefore, we should exhaust everything else first. So a lot of those things that we do, first of all, from a diagnostics standpoint, trying to figure out what's wrong with you, is to get X-rays. You may need more advanced imaging if your problem is not as easily noticeable, or if it's not bone related. If it's like a tendon or something like that, you may need an MRI. Sometimes you may need a CAT scan. So those are things like from a diagnostic standpoint that we regularly prescribe. Physical therapy, it's like one of the mainstays of orthopedic surgery, because we deal with the musculoskeletal system, the body. And so physical therapy is a huge part. Even if you undergo surgery, physical therapy is going to be a part of that recovery process. And sometimes it's a part of the preoperative process. So those that's a big one. That's a huge one. Medications, a lot of times, we prescribe anti-inflammatories, injections. Sometimes we have to do like steroid injections, and for knees, people, particularly people with knee arthritis, sometimes we do gel injections. And steroid injections are basically anywhere you have pain, you can inject. But like those are things that we use a lot. For medication standpoint, we definitely, in light of the opiate epidemic, we have been doing a really good job of curtailing the utilization of that. But sometimes in the post-operative period, a short course of those may be utilized in order to get over the immediate post-operative pain. But for the most part, we have gotten dramatically away from using those things as a social responsibility.
Mhm.
you know
Absolutely. So if a listener is currently pretty healthy when it comes to their musculoskeletal system, and, for example, myself, my mother has arthritis very bad. So in my mind, I think it's probably coming at some point, right? What are those things that people that may not have any existing issues now, from your viewpoint, what are the things that we can do to take care of our health to either make issues that may happen down the road just through genes or through luck, whatever you want to call it? What are the things we can do to try to have the healthiest system that we can, so that if something does happen down the road, we're at least starting on a good foundation?
Yeah, I think maintaining optimal physical fitness is definitely one of the most important things. There are a multitude of studies that show how important maintaining a good level of physical fitness is in order to decrease the likelihood of having multiple illnesses, and also the stronger, like let's say in particular arthritis, for let's just as an example, since you brought that up. If the muscles around the joint that's affected are stronger and used to taking up more of the load, the biomechanical load, and taking that off of the cartilage that's affected, then you probably are less likely to have pain in the first place, and lead to less degeneration of that joint. There's a higher likelihood of that happening if you maintain one, good physical fitness level. And also another thing that it's like the elephant in the room that nobody wants to talk about, is maintaining a healthy weight. Those things are important. You got to think about it. For every pound that your body has, if we're talking about arthritis again, that's the thing. Your knee joint sees about 5 to 7 times that. So if for every pound, your knee has to see about 5 to 7 pounds. So that's more force across that knee that's already, being affected, if you have arthritis. So by maintaining a healthy weight, and it's also good for so many other things, for your cardiovascular health, diabetes, like all these other preventable illnesses. If people would, be a little bit more conscious about, keeping the weight down and staying more active. And I know it's not easy to do. And I mean, I struggle with it myself sometimes. So I understand, but I think everybody should be making an effort to do those things too. I think that those two things alone, there's a multitude of other things that one can do, but those two things alone are probably the biggest things that one can do to help subside the effects. Yeah.
No matter what specialists I have talked to over the course of the last year, that is the same answer for every single specialty. I feel like it just, we need to start teaching people that in kindergarten, that good physical health, maintaining activity, and then maintaining a healthy diet and healthy weight. Those are the two keys, I feel like, when it comes to any specialist that I talk to about whatever the ailment is that they are working on. Well, Dr. Landfair, I have truly enjoyed speaking with you today. I absolutely love your history. I mean, it is just, it's so wonderful. And I love that the investment that Baycare has made in so many physicians that they have brought to the area that have not the exact same story, but a non-traditional path to medicine that really helped them from a well-rounded perspective, be able to relate to patients on a different level. And so, congratulations on being in the area. I say congratulations to the Winter Haven community, because we all benefit from having you in our community. So again, thank you so much for taking the time to be on the show today.
No, thank you. I really appreciate it. And I just, whoever sees this, thanks to people in Winter Haven, you guys have been amazing. So keep it up. I will too.
Thank you.